name is Dr. Lester Hartman from Westwood-Mansfield Pediatrics. And as typically for our films, these are strictly meant for our patients at Westwood-Mansfield Pediatrics. Your pediatrician may have different advice. Today, we are going to talk about colds in kids under 5 years of age and the course of colds. Let me start out by saying there really isn't any good treatment for kids under 6 for colds. So calling and inquiring about cold medicines, we are going to advise you to use bulb suction syringes for the nose, saline nose drops, and as well as a humidifier for only a couple of days. Now, what's the typical course of colds? Well, usually colds last between 2 and 3 weeks at max in children. And sometimes even as long as a month, but usually around 2 to 3 weeks. They have no fever, they have a mild cough with it, and they can have 8 to 10 episodes in a year. So that, and particularly from September to April. So that means they can have even almost like 100 days with nasal symptoms. And the color of the discharge, yellow or clear, really doesn't matter as much. It's more the mood of the child. And say a child after a week with a cold spikes of fever, that's more significant, and we need to know about that. So when you look at this, remember that your child, when they first start daycare, will get lots of colds and you'll think that they're sick. But if they're running around with a runny nose, happy, there's not a lot we can do, and we don't want to overuse antibiotics in children. Differences would be if a child is a big snorer and always seems congested. That can be an issue. Occasionally some kids will have allergies, but in the first 3 years of life it's very hard to figure out that because kids haven't had enough seasons in their lives to really let us know whether they have the pattern of allergies or not. And skin testing is not really reliable till age 5. And as I said, with snoring, some kids who have a lot of snoring, it can be recurrent adenoid infections. And there are children, when they get beyond 3 weeks, we put on antibiotics for sinus infections. But the mass majority of the kids, it's a typical cold. Here's a graph of the course of colds. And if you look on this axis, the y-axis, it's the symptoms of the cold. And if you look down here, the x-axis, it's the number of weeks. So what you will see oftentimes is children begin a cold, and this often can be when they first are starting daycare, and most of my focus is on kids 6 months and older. It can begin here and peak around a week and then come back down. And what sometimes happens is then a child will come in with another cold as well, and these two will overlap each other. This one is initially getting better, but then the child gets another different viral cold on top of it. And again, these are viruses, and there's not much we can do for a virus except let the body build up its immune system against it. Then there are the kids who have the constant symptoms, the constant cough, nose, maybe developing some fever, maybe not, that's just constant, where they don't get better, they just persist. And after somewhere between 3 and 4 weeks, we will oftentimes put these kids on antibiotics. But before calling us, ask yourself, gee, they had a cold, it seems to be getting better, and now they've got another cold. There's nothing wrong with their immune system. Okay, that usually means that they're fighting a new virus. If their symptoms are persisting like this and they're not getting better, that's a different story. Give us a call. We'll have you come in and we will take a look at your child and oftentimes put them on antibiotics. It's more symptoms in the history than actually our exam, because looking up the nose, really we can see if the nose is a little inflamed, but that doesn't tell us if somebody has a sinus infection that could be contributing to all this. So that's basically, remember, this is for kids basically 6 months to 5 years of age. And remember, Westwood-Mansfield Pediatrics, proactive in your child's care, empowering parents for over 50 years. Thank you and have a nice day.